I'm Dr. Lindsay. I'm one of the main audiologists that performs the newborn hearing assessments here at Audiology Associates of South Florida. And today I'm going to go over what to expect during those appointments. We perform 3 main tests during this appointment. The first one is tympanometry. That is going to measure from the outer ear to the middle ear. We are measuring the health of the eardrum and making sure there is no fluid behind there or another middle ear disorder going on. I don't have a baby today. I have Mandy here to be my patient, and we are starting with tympanometry. This is the equipment. For this test, the baby does not have to be sleeping, but they at least have to be quiet and still. We have to get a good seal in the ear, and it takes about 5 seconds, and we record the movement of the eardrum. During this test, we are looking for the measurement to follow the shape of that triangle. This means the eardrum is moving healthy. If the measurement comes in flat, most likely there is still fluid in the baby's ear or another middle ear disorder going on. The second test is called a distortion product otoacoustic emission, or DPOAE. This test measures from the outer ear to the middle ear and inner ear. During the test, it sends a tone in. The sensory cells of the inner ear receive that sound and send that tone back. We record the response at multiple different frequencies. This is the DPOAE equipment. We just have to put this probe in the ear. The baby does not have to be sleeping, but at least quiet and still for this test. Once the probe is in the baby's ear, we let the test run through all the different frequencies. The third test is an auditory brainstem response, or ABR. This test measures the whole hearing pathway from the outer ear, middle ear, inner ear, as well as the auditory nerve up to the brainstem. During this test, a sound is sent into the ear and we are measuring a neural response to that sound. This is the ABR equipment. For this test, it is very important for the baby to be fully asleep. Since we are measuring a neural response, if the baby is awake or crying, the waves are too messy and we cannot clearly identify the hearing wave that we are looking for. So for this test, we first take an alcohol pad, we wipe down where we're gonna put these stickers. We put one on the forehead, the cheek, and behind each ear. Next, we put on the stickers. Next, we attach the clips. And last, we put the inserts in the ear. This is where the sound will come out. It is important to complete all 3 tests. Some tests may be added depending on the situation, but if we do not complete the full assessment, another appointment will be needed to continue the tests. If your baby does not pass the diagnostic assessment, then we will schedule another appointment to confirm the results. If we confirm the hearing loss, then we have a whole team here to support you through the next steps on treating and managing that hearing loss.